So, hello everyone, welcome back to Otorhinolaryngology mnemonics and tutorials. So, this time we are providing you with the gold standard points in ENT that is featured in the latest or the recent edition of Cummings Otorhinolaryngology and Head-Neck Surgery textbook, which is the 7th edition. So, gold standard number 1. The gold standard for OVEX intubation and select sleep airway management techniques remain fiber optic bronchoscopy and intubation. Therefore, maintaining these skills is essential. Page is adapted from page number 60. Second, CECT remains the gold standard for detection and classification of cervical lymphadenopathy as benign or malignant. Radiographic assessment is considered the gold standard for dysphagia assessment. So we have point number 4 and 5, both are about the obstructive sleep apnea. So for the nocturnal polysomnography, A is considered the gold standard for diagnosis of obstructive sleep apnea. Similarly, CPAP. CPAP is considered the gold standard for treatment of moderate to severe OSA or obstructive sleep apnea. 6 is regarding the traumatic facial nerve paralysis. Okay. The epidural repair with fine monofilament suture remains the gold standard for traumatic extratemporal facial nerve injuries. Remember, traumatic extratemporal facial nerve injury, epidural repair with fine monofilament suture. The gold standard for measurement of nasal obstruction is rhinomerometry. Similarly, 8th, the gold standard of clinical research is randomized controlled trial RCT. The gold standard for significant mandibular defects is vascularized free tissue transfer with rigid fixation. Use of tracheoesophageal voice has become the gold standard for voice rehabilitation after total laryngectomy. Total laryngectomy is the gold standard surgical procedure for treatment of advanced laryngeal squamous cell carcinoma. Surgical prosthetic voice restoration. Remember, surgical prosthetic voice restoration is the gold standard for re-establishing oral communication in patients who have undergone total laryngectomy or the laryngectomized individuals. So 12, we have elective neck dissection is still considered the gold standard for staging of the neck. Okay, this is due to the limitation of FNSC regarding the sensitivity in neck node negative, clinically neck node negative cases. The FNSC have some drawback regarding its sensitivity, therefore elective neck dissection is still considered the gold standard. The gold standard measurement of thyrometabolic status is measurement of free T4 by equilibrium dialysis. 14th is regarding the skull base osteomeric. As you know, the gold standard imaging of the choice is through nuclear scan. So, contrast enhanced MRI is the gold standard for evaluation of cerebellopontine angles and internal acoustic canal lesions. So, contrast enhanced MRI for CPA and IC lesions. MRI with gadolinium enhancement is currently the gold standard in evaluating potential retrocochlear hair losses. Okay, MRI with GD contrast for retrocochlear hearing losses. So the current gold standard for the diagnosis of congenital CMV infection Okay, one of the common infections that leads to congenital non-genetic hearing loss, right? Non-genetic hearing loss. Okay. The gold standard for diagnosis of CMV infection is isolation of the virus from the urine, saliva, blood, or any other body fluid within 2 to 3 weeks of life is the important point. 2 to 3 weeks of life. Similarly, transmascular laryngectomy is the gold standard for surgical ablation of vestibular function. So typically, with the patient who have chronic vestibular symptoms as a result of inner ear pathology, a transmascular laryngectomy is the gold standard choice for surgical ablation of vestibular function. However, the procedure should be reserved in cases with poor hearing, because once you undergo this procedure, once the patient undergoes this procedure, what happens is that the amount of residual hearing the patient has will be totally gone. So this will be reserved in cases with poor hearing. Similarly, fine needle aspiration biopsy, it continues to be a gold standard modality for the preoperative evaluation of the parotid masses. 20. We have gracilis free muscle transfer as the gold standard for dynamic smile reanimation, one of the facial reanimation surgery. Remember, gracilis free muscle transfer for dynamic smile reanimation. The gold standard for evaluating belopharyngeal defect remains perpetual speech analysis, which consists of evaluating the language level, articulation, nasal resonance, and nasal air emission. So there are 4 product parameters in perpetual speech analysis. Endoscopic examination of airway is the gold standard for diagnosis of bacterial tracheitis. So, for bacterial tracheitis, the investigations such as imaging, radiological imaging, or blood parameters, they are not confirmatory. The gold standard is the endoscopic examination of the airway. Direct laryngobronchoscopy. Direct laryngobronchoscopy is the gold standard for diagnosis, qualification, as well as treatment planning in laryngeal stenosis. Endoscopic repair is the current gold standard for definitive repair of type 1. Remember, majority of type 2 and selected type 3 laryngeal clefts. Okay, for the type 1 laryngeal clefts, it is always the endoscopic repair. Whereas for majority of type 2 and selected type 3, you have endoscopic repair. For type 4, you have open repair. And also, a majority of cases of type 3 also are corrected with open repair. So that's all about the gold standard points in Cummings Otorhinolaryngology and Head-Neck Surgery 7th edition. So please subscribe to our channel for more of the such videos, more of the topic-wise discussions and mnemonics. Thank you.